over time, but there's no way we can let these three keynote presentations go without a chance for some interaction and questions and comments from the group. We already have a question forming up from the audience here. So would you like to start?
Thanks for very engaging, enlightening presentations. My question's for Alys. It's around, you found some risk associated with those pharmacotherapies. I might have missed it, and I just want you to clarify what the comparison was, because I'm wondering how those risks compare to if a woman was to continue to smoke during pregnancy.
Yeah, so you might recall that I mentioned we were interested in exposure in the first trimester because that is when the congenital malformations, when there's a risk of malformations. So these women we think are smoking during pregnancy and using a pharmacotherapy compared to women smoking. So I think it's the underlying risk of smoking is there for both groups, and it's the additive effect of the pharmacotherapy that we're seeing.
Okay, you had your hand up first, and then to Toby.
Sorry, Alys, another question for you, just around those results and the fact that there were multiple outcomes you were looking at, and I guess the chance that it might have been a finding by chance because of looking at so many outcomes as well.
Yeah, it's so true, and I think that's a challenge in this kind of work. You don't want to limit yourself to just a few of the outcomes. Obviously, the malformations all have a different etiology, so we do need to consider them all. But yeah, it would. I guess the next step is another study. Yeah.
Thank you. I'm just here. And if there's anyone else, let me know. Okay, great.
Thanks so much. This is a question for you, Hayden. Would you adjust the risk and benefit balance that you were talking about in response to the work on commercial determinants of health?
Yes, that's another factor to be considered, and I think actually we've probably moved over the time frame. If I think back to 2007 when I first looked at these products, and they were all outside of the tobacco industry, but still a commercial organisation. But it's shifted quite a lot in recent times. So, there's another, and again, I think this is why we need to keep being able to be flexible and adapt and change the need. I think we're seeing much more, even though they're unable to advertise for vaping products in many countries. There's this underlying different ways of promoting their products, and that's a real strength of these organisations that have had companies that have had years and years of experience in that.
Thank you, Sarah. And we're good, right?
Yeah, okay. We're okay. It's been a really good session, I have to say. So Sarah Farnback from NDARC. Thanks everyone. They were really great presentations, and there was a really nice kind of logic flowed through them. I think my question flows on a little bit from the previous one. Just listening to you talk, Rob, and then listening to you talk, Hayden, about the commercialisation and the impact of these big businesses. It seems like this e-cigarette space has been vulnerable to that, and I'm just left kind of scratching my head, thinking about the data that you were presenting, Hayden. There's not a lot of evidence yet about harms. Are we really going to wait until, a generation until we've got this evidence before we can come back to these commercial companies? I'm not sure. It just seems like we're doing this same thing again and again. So I just was asking your reflections, really, Rob, on the e-cigarette space and the dual kind of world and how that all fits together.
Well, and I was talking to Hayden. You had some fascinating real battles between the harm reductionists. A lot of whom I worked with in HIV and thoroughly believe in that approach, and then an application of the same thinking in a very different context. All you do is watch what the tobacco industry is doing. Watch what they're doing. How do they make money? How do they control the situation? Why do they buy? Why are they buying large vaping groups? I mean, they know it's a way of, they know it's a gateway, and the gateway's been proven. So they know it's a way of actually recruiting new users. And all, as I say, all they need to do is keep something in your hand, whether you're 14 or whether you're 40. And it's now got sort of, you know, non-nicotine containing vapes, containing vapes, heat-treated tobacco and burnt tobacco. So they've got a range of products they can now use. And, you know, Hayden's point about really how do you best control the situation. I mean, I must admit, I've always thought, legislation, regulation, education are the ways to go with all drugs. And as you were saying, ban it is a very blunt instrument. I think we have to be much smarter in how we do manage it. Who's actually pushing illicit sales of cigarettes? We know the tobacco industry is involved in that, and has been for years. So it's really working very hard to expose what they're doing, to provide appropriate and as Hayden's saying, appropriate and enforced regulation. It's interesting in the other areas where we've looked, we've had no regulation around ultra processed foods. None. If you ask, there was a recent, sorry to digress, but there was a recent survey done by I think AFL and NRL on advertising in sport, right? And everybody jumped up and down about gambling. Why? Because there's so much of it. Hardly anybody said the fact that Australian sports people are the ambassadors of booze, junk food, and gambling. I mean, sport's really good for kids, but it's done in a context where they're told a whole nother story about how they should behave.
Hi, thanks very much for a very lively and provocative thing. Could I just broaden it out a bit and ask both Hayden and Rob that while you're talking about regulation in vaping, globally we're looking at the legalization and deregulation of cannabis. And where do we fit that into our regulatory framework?
Yeah. Thanks, Michael. I think we've got a lot of lessons we can learn. We don't have to start from the very beginning all of the time. But it is interesting when you're seeing, and you've seen this in Thailand. I've seen this when I was in Canada, and suddenly you've got an increasing number of people using cannabis. Now, cannabis isn't safe either, and especially the effects on the developing brain, all those things we talk about with nicotine. It's has perhaps a slightly different perception to it, but look, I think we need to. If we make things available onto the market, then we've got to have controls wrapped around them. I think we'd be in a very different place if vaping wasn't in a market. Then yes, you could possibly think about some really heavy restrictions that almost bordered on ban. But the fact is it's here, and the fact is that cannabis is here, and so therefore you've got to take an approach that's a little bit more scientifically based.
Thanks. I mean, as a former rugby player, I looked to New Zealand for lots of inspiration on a whole range of issues, and I agree. But I think always, if we look at so much of why they illicit drugs, because of Nixon. That's why there's a war against drugs. It's because of Richard Nixon. And we've taken it on for the last 60 years. And then managed to get such traction. But the point is, I think regulation and legislation and education are the ways to go for virtually every drug, and managing that in a way that society can manage it and, as Hayden said, have some level of control over it. Would be my perspectives, and why we're not doing it in the other areas. I think we're watching in the US. You're just watching the cannabis groups go boom. No regulation, no nothing around them, but and they will cause major harm. Why? Because there's so much money to be made out of it.
Colleagues, we've got plenty of time for questions and discussion during the social event after this. So how about why don't we all thank our presenters one last time very much.